I'm now joined by Advocate Ezra Letsoalo, chairperson of the Health and Wellness Portfolio Committee in the Gauteng Legislature. Very good afternoon to you, sir. Thanks very much for your time. Something caught my attention in the statement that you released, and it is this line. While social media can swiftly highlight public issues, such posts often lack the comprehensive context needed for well-informed conclusions. I don't know if you can hear me.
I can hear you now.
Yes, I don't know if you heard, I was quoting a line from a statement that you released which says, quote, while social media can swiftly highlight public issues, such posts often lack the comprehensive context needed for well-informed conclusions.
Yes, sir.
Why did you feel the statement was necessary?
It was in the sense that, this is an issue that is before the public, and obviously as an oversight committee, we needed to appraise a society that we are aware of it, and we're not just sitting on it, but we have made follow-throughs with the department. But of course, and notwithstanding that, is that often at times you pick up the issues outside of a formal, structures, which are created to ventilate those kinds of frustrations. And it makes it a bit onerous for the committee to be able to follow through because for one of, the actualities of what will have transpired, the committee might not necessarily be able to follow up. So hence, in the broader framing of the statement, we make a point that it's encourageable that those that interact with public health facilities, as in when they've got the grievances, as in when they are, disaffected by specific observations, they should also be able to leverage existing systems which are created for that purpose. And that is why we'll have stated that, notwithstanding the gravity of the matter, we deemed it quite necessary that, it actually assists the committee quite a lot.
That particular line I would put to you comes from a particular place. And I would go further to even argue that it comes from, there's a denialism about it that may look subtle or, at face value, but comes from a very a certain place deep inside your heart and mind. Because I would argue that you could have said, we will launch an investigation, we will look at what happened without including that particular statement.
Well, I beg to differ. And the reason why I would hold this view is that often at times you come across complaints, which are ad hoc, which are raised, on different platforms. And even as much as we facilitate the public education on different platforms, you would still find a scores of people who would prefer to raise the issues, quite informal, And so the point that we make, which I want to recapitulate, the point which I make is that it enables the committee quite easily, to be able to interact with those that are aggrieved, immediately, so that we can be able to escalate the issues, possessing the necessary relevant information, because by not so doing, how else is the committee expected to play its oversight, effectively? I mean, we don't sit in the legislature monitoring social media platforms. And I'm not so sure the rationalization about the statement coming from a different place, what motivates that specific view, because the view that we hold as a committee, and it's not for the first time that we have been encouraging, the residency of Gauteng, that as in when you pick up issues, please do record them formally, channel them through the committee so that the committee can be able to hold the department accountable on your behalf, because we are exactly, public representatives with a mandate to ensure that we bridge the gap between society as well as, the government of the day. So I'm not particularly sure how to go about your own formulation about, our intentions of couching the statement the way it's couched.
Forget about Mr. Tom London for a second, Advocate Letsoalo, and just cast your mind back to a report that former health ombud, Dr. Makgoba, delivered last year. It was a scathing assessment of the state of public facilities in the province. And it went into, it detailed, the challenges, everything from staff shortages, medicine shortages, broken equipment, low staff morale, high patient loads. The list is endless. Go again to reports that the TAC and other NGOs have been putting out there, moving from province to province, including, of course, Gauteng, that details the experiences of patients at clinics and at hospitals in this province. And if indeed, you take as seriously as you say your oversight role, you wouldn't need a Tom London to know that there's something fundamentally wrong in our public health facilities in Gauteng.
But of course, and I think going back to the point that I made earlier, that here's an issue that is before the public media, space, and we are called. We received quite a number of calls on this specific issue. Needless to say that we have also recorded, through our oversight function, that there are cases which are formally recorded within different health facilities, and ordinarily the committee does follow up with the department around how they are processing, evaluating, and resolving those specific issues. And periodically, the committee does receive report, and those reports are even there for public consumption around the modalities of how the relevant quality assurances units in different facilities go about the processing. And I think we also make a point in the statement that part of one consensus about how the department might be dealing with specific cases would be the turnaround times. And I think there's an admission based on an observation that the committee will have made over the number of years. So there is no denialism whatsoever that there are major, shortcomings, there are major systemic problems besetting the public health, sector. And of course, as and when we interact with the department, part of our accountability standards includes some of those. So if you talk about overall access to healthcare, we look into the quality provisioning of that. We would look into quite a number of issues, whether there's access to, a medication, whether there's patient safety, whether there's a cleanliness. So all of those issues are recorded, and they also make a feature in our reports. So we're not in any way, paper toweling the problems that are plaguing the department. And I think through our own committee system, we have been able to raise the concerns, even passing recommendations through the legislature that we need remedial action insofar as those observable issues are concerned. And those have been passed as legislature resolutions, no longer just a committee resolution, but legislature recommendations, wherein we would request the MEC through the department that we be given specific mitigation plans and around how they intend to turn around these situations. So these are issues that we're observing, and there is no denialism whatsoever.
But it certainly does appear to be tone deaf. It doesn't show compassion. It certainly doesn't show care. But I want us to talk about, and this is something I asked someone who serves in your committee as well, Jack Bloom, earlier, that there is clearly something in our system that is missing, where all the problems are known. They get spoken about day in and day out. But somehow our oversight system isn't able to deal fundamentally and comprehensively with these well-known issues. As I say, I've referred here to the report of the Ombud. I've referred here to organizations that have really done well over the years to highlight the plight, especially of the most vulnerable sections of our society, your TACs. Yet very little gets done to actually fix these problems. What do you think we are missing or is wrong with our system?
Yeah, maybe let me start off with the point that you are making, that might be a bit unsympathetic. I wouldn't want to believe, that assertion, because from time to time, like I will have earlier stated, we even act proactively, to undertake oversight visits, interact with different, users of the public health facilities. To a greater point, I mean, there has been a stack of contradictions, even lamentations on the part of the committee directed towards the department. So I thought maybe let me clarify that. But I'll tell you, there's a number of variables that goes into it. And I think in our own assessment, part of the problem could be attributable also to the leadership quotient overall, because the public health sector is quite big. And of course, you might have one central department, but with a number of tentacles, and the standing of a specific managers at different platforms of a service where service delivery is being, facilitated, could somehow miss the point about the overall vision that the department would ordinarily communicate, including not having a greater appreciation of the overall policy outlook as well as a legislative mandate, such that there's a greater compliance. So I suspect we might want to probe the leadership quotient around the entirety of the system, and not just at the central, point of a coordination. So that would be the first thing. The second thing, it's a little known issue about the strangulation, budgetary, strangulation, whether the current budgetary, envelope that is there, it's quite sufficient to be able to respond to the overall health needs, because you are also dealing with historic issues. And so the budget that is allocated would be allocated for a specific financial year, but it might not necessarily factor in other, contending issues. So it could be issues pertaining to historic and medical legal challenges. It could be issues related to infrastructural backlogs. It could also be, problems related to, staffing. There's a competitiveness around that area. So the recruitment of healthcare professionals often seems to be a major hurdle. And then the third thing that we also have got to appreciate, which a number of agencies talk to, is the extent of migration into the Gauteng province, which also adds on to the already existing burdens to the facilities. So those are some of the issues that we ought to be looking into, particularly because an overloaded system is likely not to be as optimal in its intended functioning. But of course, there may be, an array of other issues that I suppose public health experts could possibly, speak more eloquently on. But I suppose in a nutshell, those are some of the overarching challenges that are there.
And of course, the oversight role that you have to play, because really the point here is this is not even about Mr. Tom London. It is really about the plight of millions of South Africans who depend entirely on the public health system for their health needs. And the public health system, they want to be compassionate, to be caring, and to be efficient. But let me thank you for your time this afternoon. Really appreciate it.
Thank you so much.